In this unit, we are going to explore how to evaluate a health promotion initiative and why it's so important. So by the end of this entire unit, and we're going to divide it into different parts, I want you to be able to differentiate between formative, process, and impact evaluation. Formative evaluation is the type of evaluation that helps to inform how you're going to develop, design, roll out your program. Process evaluation, it's all about like the rollout and what actually happens when you roll a program out, when you implement a program. Is it being implemented the way you designed, and what kind of challenges came up? And impact evaluation, this is really about like, was there a response? Did you get the results you were looking for? How did people's behavior change? How did like higher level outcomes change? Those are the three types of evaluation. And in this entire unit, you are going to learn about all three of these, as well as how to structure, or at least begin to think about structuring an evaluation plan that'll help you, design a great intervention, but to also get these tangible data points, this tangible evidence that can help you make better decisions in the present and in the future as well, and for other people to help make better decisions too. But also the great thing about evaluation is that if you want to, let's say, scale your program, or you want more money for your program, evaluation helps to provide the evidence for whether your program worked or not, and whether it's worth investing more time and effort into. So evaluation is key to any health promotion initiative. So before we get into specific evaluation types, I do want to spend some time just talking about accountability, because that's such a key concept that centers this evaluation conversation. Like, to actually roll out a health promotion initiative, depending on the scale of this initiative, it's usually like a ton of work. It's usually years and years of work. It's years of research, of engagement, of like figuring out our organizational constraints, or to getting money, all this kind of different stuff that goes into this health promotion initiative. And then like, what if it all falls flat? Or what if it doesn't do what you intended it to do? Like, who are you accountable to? Are you doing these health promotion initiatives just to do them? Or are you looking at like, does it actually make a difference to the population in a way that is like in line with what they actually want or need, right? So what's the point of spending so much time funding, implementing a health promotion strategy if it isn't viewed positively by your target population, if the outcomes aren't valued not only by that population, but by stakeholders, and let's say funding agencies, or the people that are actually running the program, if it costs too much, if it takes too much effort to run, if it's not sustainable, if only like 5% of people change and 95% of people don't, like, what's the point of it all? We are accountable to the people that help us design and deliver this program and who fund this program. And of course, we're accountable to the target population that ideally we're working with from the start, and that we ideally want to do good by. And then how do we define good? Well, we would use that target population to help us inform what is good, what is a desirable outcome too. So accountability is key to this conversation around evaluation. Who are you accountable to? So a lot of the concepts that we're going to cover in this unit do come out of this amazing book that I'm going to keep promoting, which is Health Program Planning, Implementation, and Evaluation, by a bunch of big names in the health promotion world. Of course, Lawrence Green had to be in there as well, because it does focus on the pre-seed proceed model. But regardless if you're using this specific logic model, there's a lot of really important insights into this book as far as how to design, implement, and evaluate your program. So what is evaluation? I love this, is looking at the word value in there. Like, what value did we provide? What is seen as valuable? What is not seen as valuable? So evaluation is the systematic comparison of an object of interest with a standard of acceptability to provide evidence that is useful to inform decision-making and to demonstrate accountability to social values or policies. So what does that mean? So with evaluation, you have this plan that's very thought through, where you figure out which outcomes are of value to you or that are going to help to inform whatever you're doing, and that you're also really thinking about like what's acceptable, what would be an acceptable difference, what would tell me that this thing is successful. That's that standard of acceptability. Like what would tell me like, yes, this was worth my time, this was worth the effort, I did well by my population, right? That is a point of evaluation, is to create these strategies using often mixed methods to figure out, was this program of value? And so value judgments are required, right, about the worth merit of the program being evaluated. And then what's key to this is that you're deciding, or the value of the program isn't just being decided by like one person, like say the funding agency or one particular stakeholder, but like ideally you're having conversations from the start around like, listen, we're doing all this stuff, what are we working towards, and what would we be so proud to say this led to, right? So these are conversations that need to start early on, and especially if we want buy-in from everyone involved, we want to start talking about like, what is a tangible outcome of value to everyone involved. Okay, so as I keep kind of alluding to, the best planning is participatory, involves participatory evaluation from the start, as in you're like discussing with your people, your targets, your facilitators, your funders, your stakeholders. You're talking with all these people about like, what are we trying to do here, and what would tell us that it was successful, right? And then something to consider there is, have you considered who is a stakeholder? Like, who cares about this particular outcome or this particular population, and who needs to be at the table? So for instance, if I'm designing a health promotion strategy for undergraduate students at SFU, why aren't SFU students at the table? Why aren't they part of this conversation? Right? Of course, we need our target population there at the table. It can't just be administrators making these decisions, because how do we know what actually the problems are or the values are of these populations? So we want to involve the participation of everyone that can help make this program a success right from the start. And then we have conversations with these people too, and as part of the mediate part of the Ottawa Charter, for instance, is like, not everyone's going to have the same beliefs about what would be a valuable outcome. So where do we get to a place where we find outcomes that kind of everyone can get invested in, or some that some people are invested in and some that other people are invested in? Right? So think about managers and practitioners, recipients and intended beneficiaries, like your target population, and then policy and decision makers. So when you're thinking about what things you're going to evaluate, you might want to think about how you're going to market this program to get more funding, or to like scale it up to, let's say, all of BC, or to all of coastal health, or to all of the universities within BC, right? So why are we evaluating? Who wants the evaluation? And how is that going to inform decision making, right? We're not just evaluating for the sake of evaluating. We're evaluating because how do we know that this was worth our time? And when you're evaluating a program, sometimes people focus just on the positive outcomes, but you need to keep in mind, like, what are some negative things that came up too, because that can help you make better decisions in the future as well. It's not about being perfect and designing the perfect program that like cures whatever disease, right? It's about, we're rolling out programs in specific contexts to diverse populations where, that are just full of complexity, right? So what do we need to know? What information do we need to gather? And what's going to help us deliver a program that's of value to this particular context? So in this full module, we are going, and in future videos, we're going to go over the different types of evaluation, and we're going to categorize them into 3 groups, although they're not always that nice and discrete. But in this same video, I'm going to talk a little bit about formative evaluation. And this is the evaluation that like helps dictate how you like design your program, right? Like, what information do you need right? What do you need to know about people's beliefs or attitudes or current behaviors? What can I evaluate about my population or the organization that population or the setting that population lives in and works in? What do I need to know and evaluate and gather data about from this particular population before I can make decisions about how to design my program? So it helps to form the program, formative. Okay. Whereas process evaluation, that's more on the side of, okay, we've decided more or less what our program looks like, and we have a plan for rolling it out. What am I finding? How do I evaluate how well I rolled it out? And what are some of the issues and unexpected events and successes just in the rollout of that program? And then outcome or impact evaluation, this is more like, did it change the thing? Did it change the thing we were looking at? So did unplanned pregnancies go down by 15%? That's more impact evaluation. Whereas process evaluation might be like, were we able to distribute all of those pamphlets to this specific group during the time frame we decided upon? And then formative evaluation, which would come before that, might be like, what types of media does my population use that might help me decide on, how to deliver this information to them. Okay, so all three are important, but we kind of maybe speak to them a little bit differently. So I've alluded to formative evaluation, but just to give you a little bit more insight into it, formative helps to form. It helps to dictate how you design or maybe deliver your program. Right? Formative evaluation is a rigorous assessment process designed to identify potential and actual influence on the progress and effective implementation efforts. So what information do I need to know before or as I'm designing whatever intervention I need to do? Right? So it's usually early stages or while something's going on, but the whole thing about formative evaluation is like, it goes right back into the program, right? So it's not like the program's over and now I'm measuring if there was a success. It's like, I need to evaluate kind of the current landscape or what's going on before I can decide what's the best implementation or design strategy, right? And then without it, meaningful outcomes within specific contexts can be compromised. So you might have found an awesome study that showed that this particular school in Australia delivered a specific program and it was super successful. Awesome. If you just copied that program in a Canadian setting, in a particular, let's say a rural part of Canada, who's to say that that same program is going to work well? I need to understand their context. And I need to gather information that can inform the design of a program specific to that context, right? So formative evaluation, in order to get to the meaningful outcomes within a specific context, I need information about that specific context, okay? Like I said, it helps to identify potential implementation barriers as well as opportunities. And then whatever information you get from formative evaluation, it goes right back to the team. It's like, hey, this is some of the information I've figured out or that we've gathered, and now that's going to help me design this a particular way. Hey, during formative evaluation, we found out that students really don't take pamphlets ever, and if they do, they don't read them. What they do, the media they do use is Instagram. The media they do use is TikTok. So instead of focusing our efforts on pamphlet distribution, we're going to focus some of our, communication messages over these two types of social media. Okay, so you gather information that goes right into developing, designing, or implementing that program. Okay, like all evaluation, often formative evaluation uses mixed methods, so both qualitative and quantitative strategies. So for instance, focus groups, expert consultation, interviews, or just like observing an organization or a particular setting, those can go into formative evaluation. And then surveys can also be a part of that. And in a future video, I'll talk about the designing of surveys. So some questions that can inform formative evaluation is, what values, beliefs, knowledge, skill sets does your population have that are important to know before you can decide on the best strategies? What does your population want? What is their higher level goals? What's valuable socially or behaviorally or anything-y to that population? And what are the organizational constraints, and how can a program potentially be improved as well? Because formative evaluation can also occur while a program is being delivered. So with that in mind, formative evaluation is one of the 3 types of evaluation. It happens to inform the design or implementation plan of your initiative. This is one of the strategies within program evaluation of health promotion initiatives. In the next few videos, we're going to talk about process evaluation and then impact evaluation.